Alright, today I'm going to be administering medications to Emma Wrightson. So first what I'm going to do is I've noted that I've compared my medication administration record to my physician's order, so I know that everything on the MAR is correct. I've also verified that my patient has no known allergies, so nothing I give today will be a problem with the medications I give considering allergies. I've also verified that the primary line running is normal saline and it is running appropriately. So now what I'm going to do is I'm going to make sure that the med I pulled up is the right med for this patient. So this is for Emma Wrightson. I'm giving Cloxacillin, 1 gram. This is a 2,000 milligram vial, so I am able to get 1 gram from that. IV, this is an IV infusion medication every 6 hours. The patient has not received it yet, so that is okay to give, and this is also not expired. So I know that I have the right medication. I'm going to verify I can give this as a student nurse. So first what I'm going to do is I'm going to be adding 6.8 milliliters of sterile water to reconstitute my medication. So I'm going to wash my hands. Grabbing my 10 milliliter syringe, I'm going to hook it up so I can get 6.8 milliliters. This is brand new, banana peel open, and adding a blood fill. This is brand new, never having been opened as well. Okay, now that I have that ready to go, I'm going to pull back 6.8 milliliters of air. I'm now going to wash the top of my vial for 30 seconds and dry for 15. Now that I have 6.8 milliliters of air to reconstitute my 2 gram vial, I am going to insert.
Again, best practice is for
a circular motion. Oh, I forgot to pull up the sterile water. Okay, that was a mistake, but that's okay. This is still sterile. So that is not a problem. Here I have my sterile water. I can re-get this to 6.8 milliliters.
So our dose that they wanted is 40 mg. And the dose on hand now has
Cleaning the top of this for 30 seconds, drying for 15, and I have verified that that is in fact sterile water.
Then I will just
Pulling out 6.8 milliliters.
30 seconds, leave it to dry for 15. We're going to wash our hands again. And then we're going to use the same needle.
Alright.
Again, making sure this is in a place
Swooping
where
that.
so we're going to inject air, which is 10 ml. And then
A tiny bit of extra. This is sterile water, so I'll just put it over the sink. And here I have 6.8 milliliters of sterile water. I'm now going to add this to my medication to reconstitute. So I'm going to clean the top of this for 30 seconds, drying for 15. I'm going to inject this in a circular motion to make sure all of the powder is wet, letting out some of the air. I'll recap this. I'm now going to rotate this in my hands for a few seconds just to make sure all of the medication gets properly reconstituted. Okay, I'm now going to pull up my medication. So I'm looking for 4 milliliters. The total volume right now is 8 milliliters with 2 grams. I want half of that, 4 milliliters. So I'm putting this to 4 milliliters. Cleaning the top of this for 30 seconds and drying for 15.
So for my second check for this patient for medication is 10 Cloxacillin. Dose that they wanted is 40 mg, 40 mg. So the volume is 10 ml, and there is 10 ml here. And then throughout
Okay.
intravenous, intravenous daily, and it's now. So again, intravenous is compatible. And then we are just going to flip back to our CIVA chart to check any further dilution instructions.
I have a little bit of extra, so I have a med cup here, and I'm going to be wasting into the med cup. And this is going to go into the med waste container. I now have 4 milliliters of my medication.
So this is already a 10 ml.
Before I add that to the CIVA syringe, I am now going to do my second med check, just to get that out of the way. So I have pre-made my med label. This is for Emma Wrightson. I am giving Cloxacillin, 1 gram. I have pulled up 1 gram, reconstituted with 6.8 milliliters of sterile water, which had 2 grams of medication, so I want half of that, 4 milliliters. Here I have 4 milliliters. This is IV. I'm going to be giving this CIVA every 6 hours. It has not been given yet. Okay? So now what I'm going to do is I'm going to take my 60 milliliter syringe. I am going to add a blunt fill to this. This is a brand new blunt fill, and I'm going to maintain the sterility of this. And add this. Okay, so I'm adding 46 milliliters of normal saline. So I'm pulling back to 46. I have verified that this is normal saline. I'll be pulling it from a mini bag since it's a higher volume, and it is brand new, never having been opened, not expired. So I'm now going to clean for 30 seconds. Drying for 15, I'm going to inject my air. And I am pulling out 46 milliliters.
The volume should be 10 ml, so there is 10 ml here. Route is intravenous and time and frequency is
Yeah, I'm going to put it down, but I'm making sure I'm not pulling the needle out of here while I grab it.
Cabinet before I left. Okay, so I did my third check. So Miss Freeman, this is pantoprazole. This is your medication for your peptic ulcer disease. Some side effects is that diarrhea and headache. So if
Okay, I have at least 46, so I'm going to take this out, recap it.
So I stated the right reason for this medication. So at this point, the patient has the right to refuse. Patient did not refuse, so I can go on.
Okay, and this is normal saline, so I'm just going to pour it into the sink until I have 46. This is now 46 milliliters of normal saline. Now what I'm going to do is I'm going to add my medication, which I've already done the second check for, into my 60 milliliter syringe. So I'm going to pull back a little bit to make sure I have room. I'm going to take the blunt fill off of this and put that into the sharps container.
I'm going to go back to the med room to check if, and then I'm going to exercise to check.
That is going to go into the sharps container. I'm now going to add a blue cap to this, which I have here. And I am going to push up to make sure all of the air out. There's a few bubbles. I'm just going to tap this out. I'll add a blunt fill just while I tap them out because the blue cap won't allow me to push up. So I'm just going to add a new blunt fill. Okay, so all of the air is out of here. I pull back, and I'm now going to add a blue cap. Okay, maintaining the sterility of both the blue cap and this was put in backwards, so normally it'd be a little bit easier to open, but I'm still maintaining the sterility of it. Putting that on, I'm now going to push up to 50 milliliters, making sure there's a bleb at the top. There is a bleb. I'm adding this on. That is now ready to go for a total volume of 50 milliliters in a 60 milliliter syringe. I am now labeling that. Could I get the time, please?
8 minutes, 38 seconds have passed.
Okay, so now that I've already done my second check, I'm just going to review the parenteral drug monograph to know exactly what I'm giving. I know my patient was scratched by her cat, so she's getting an antibiotic to deal with the cellulitis that she got as a result of that. And I put my medication away. So Cloxacillin, this is able to be given as a student nurse. I'm giving 1 gram, which is appropriate for, which is within the usual dose. I have reconstituted it appropriately. I know that she's been taking this already, so I'm not worried about a hypersensitivity reaction, but she may experience nausea and diarrhea, and I've reviewed all of the additional hazards, so I know that this is ready to give. I'm also going to verify the CIVA. 1 gram, which is my dose. I'm giving 50 milliliters in a 60 milliliter syringe, which is what I have, over 39 minutes. I'm now going to close that, collect my supplies, and I'm going to head to the patient's bedside. So I have my medication, my math, my microtubing, alcohol swabs, which I have ready to go, and my MAR. Okay, now that I have everything I need, I'm going to head to the patient's bedside. Knock, knock, knock. Hello, my name is Heather Milan. I'm a student nurse and I'm here to give you an IV medication. So what I'm going to do first is my safety check. The patient is not in distress, the call bell's in reach, and there are no hazards. The room is safe to enter. I am now taking my MAR and verifying that I have the correct patient. First, I'm looking at the patient's wristband. Here I have Emma Wrightson. Emma Wrightson, 1, 2, 3, 4, 5, 6, 7, 8, 9, 1, 2, 3, 4, 5, 6, 7, 8, 9, with no allergy band. I'm now going to ask my patient verbally for their first name, last name, birth date, and whether they have any allergies. That all checks out, so I know I have the correct patient. I'm now verifying that the primary line is running as it should be. This is normal saline, which I've reviewed is compatible with the medication I'm going to be giving. This is running as it should be at a to keep vein open rate. And I'm looking at the IV site. I'm not noticing any signs of phlebitis or infiltration, and the patient is not reporting any pain, so I know that this is an okay site to use. I'm now going to go ahead and do my third check of the medication. This is for Emma Wrightson, Emma Wrightson, Emma Wrightson. This is Cloxacillin, Cloxacillin, 1 gram, 1 gram. I diluted the medication or reconstituted to a volume of 8 milliliters, 2 grams per 8 milliliters, so I wanted half of that, so I had 1 gram in 4 milliliters. I then added that to 46 milliliters of normal saline for a total volume of 50 milliliters, which is 1 gram. IV, I'm going to be giving this via CIVA every 6 hours. It has not been given yet, so I know it is appropriate to give, and to give now. So what I'm going to be doing now is attaching my tubing, but first I'll educate the patient a little bit. So today I'm giving you your Cloxacillin. This is for your antibiotic for your cellulitis you received after a cat scratch. You've had this medication for the past few days, so I'm not concerned about anaphylaxis or an allergic reaction. However, you may experience some side effects, which may include diarrhea, nausea, or any stomach upset.
3 minutes.
Okay, do I have your consent to give you this medication? Yes? Okay, so I'm now going to give the medication. I've selected a brand new bag of microtubing. This is brand new, so I'm going to hook this up to my medication. Maintaining the sterility at the end of this.
Dose is, so medication is pantoprazole. Dose is 40 mg, and it is compatible via the IV route. And timing frequency.
I put this on very tightly.
And then I'm just going to
There we are.
So the expiry is good. So since I'm
Hooking that up while maintaining sterility. I am now going to forward prime, so I'm going to take the cap off of this, putting it on its side, and pushing until I see a bleb. Okay, I see a bleb and no air bubbles, so I'm now going to recap this. Okay, so I'm now going to clean the port on the patient. I'm selecting the port closest to the patient's wrist because they're not receiving any push medications. I'm not concerned that anyone is going to need access to this port. Maintaining the sterility, I'm up and attaching that on. This is forward prime, so I'm now going to attach this to the CIVA.
For 15 demo purposes, we're not going to do the whole thing. In case I forgot to mention, patient is.
Okay, I wanted this to run over 39 minutes. That is 39 minutes. So now that this is forward primed and it is attached, and this is running appropriately, I'm going to press start. I notice a green light, which is what I want to know that it is infusing properly. So I will tell my patient that I will be back in a few minutes just to make sure it is infusing appropriately and they're not experiencing any side effects. I will also let them know I will be back at the end to flush with 3 milliliters to make sure all of the medication is given to the patient. If they have any issues, they can ring the call bell and I will come to help them out. This is infusing properly, the patient's call bell is in reach, the patient is not in distress, and there are no hazards. So I'm going to sign my MAR. Heather Milan, University of Manitoba Student Nurse 3, given at 3 o'clock. And I'm going to be documenting what I assessed before giving the medication, the reason for the medication given for cellulitis, any other nursing assessments I did prior to giving the medication, and I'll be doing my exit safety check so the patient is not in distress, call bells in reach, there are no hazards, taking everything out of the room, and my MAR is signed and everything has been documented.